This is ABC-7 News at 10, Chicago's #1 news.
Tonight's special segment, the hip rip. Pregnancy can cause all kinds of aches and pains, especially in the hip area. But what if the pain is still around weeks, even months after the baby is born?
Healthbeat reporter Sylvia Perez joining us with this story. Sylvia.
Kathy and Ron, Yankees star Alex Rodriguez made headlines when he announced he had torn the lining around the rim of his hip. It is called the labrum. But these tears don't just happen to elite athletes. A suburban orthopedic surgeon says some women, especially those who've had children, may have this problem and not even know it.
Okay, you can relax now.
It's been years since Pam Wenzel has been able to relax. She says severe pain in her groin area was making life miserable.
Deep inside, there's pain coming in here, right in here somewhere.
It began with a difficult delivery involving her third child, who weighed 9 pounds, 7 ounces. Wenzel says during labor there were complications. Over a 9-year period, she saw 16 specialists and was diagnosed with everything from MS to bad periods.
No one's ever said, you know, maybe it's coming from your hip.
Enter surgeon Benjamin Domb from Adventist Hinsdale Hospital. Domb says he's seen about 10 women with labral tears, and he believes carrying extra weight during pregnancy and possibly the physical part of the delivery may be to blame.
The positions that the hips are put in during delivery put women at risk for labral tears.
The labrum is a ring of soft tissue that lines the rim of the hip. Athletes are at a higher risk of developing a hip labral tear, but structural abnormalities of the hip can also lead to a rip. Orthopedic surgeon Charles Bush Joseph is with Rush University Medical Center.
A tear may be present, but is that a clinically significant tear or truly a cause of the patient's problem? That's what's in debate.
Bush Joseph isn't so sure about a significant connection between difficult births and these tears. He says in the last several years, with newer imaging, experts are getting better at diagnosing all kinds of hip problems. And more often than not, hip pain can be caused by a combination of problems, and surgery isn't always the solution. Dr. Domb treats these injuries with a minimally invasive surgery where the tear is stitched up. The hope is the repair will end the pain and delay the onset of arthritis. Domb stresses many women do just fine with vaginal births, but thinks in some cases this injury is being overlooked.
Just an awareness of the potential for hip injuries during the process, I think, can be a big help in preventing hip injuries during delivery.
Wenzel has learned she has several issues with her hip, including the tear. She's planning to have surgery in the coming months to fix the tear and will have some bone abnormalities on her hip repaired. She says the biggest relief is now knowing what is at the root of her pain.
It's almost unbelievable that I could see so many specialists and not one of them could have pointed me in the right direction.
A recent study by orthopedic specialists in Ireland noted a possible connection between pregnancy and labral tears, but many doctors we spoke with say more research is needed and that these cases are probably more the exception than the norm. For more information, you can go to our website, abc7chicago.com, and obviously not the norm because millions of women have babies every year with no problems, right?
Thanks, Sylvia.